The all-new Apple Watch Series 4 is an impressive piece of technology. One of the most talked about features is the new ECG function. In this video, we'll talk about just that. What's going on, guys? Dr. Jabal, MedSchoolInsiders.com. To understand the Apple Watch ECG function, we first need to talk about a traditional ECG. Now, the ECG, or electrocardiogram, measures the electrical activity of the heart. Now, in order to measure the electrical activity of the heart, we need two or more electrodes that have a vector that passes the heart. These electrodes give information to the computer, we can calculate the voltage difference, and then based on the vector and those voltages, we can diagnose various pathologies of the heart. Not all ECGs are created equal, however. So the most traditional ECG we have is the 12 lead. This is where we have 10 electrodes. 4 on the limbs, and then 6 on the front of the heart, front of the chest. And using these 10 electrodes, we can create 12 separate vectors. These vectors give us the information necessary to have a pretty comprehensive look at the heart's activity. So where does the Apple Watch fit into this? Well, the Apple Watch is essentially a lead 1 ECG. The first electrode is the ceramic back on the actual watch body, and the second electrode is the crown, which you touch with your opposite hand's finger. Now, this lead 1 is very effective at measuring the rhythm of the heart, and that's why this is such a good fit for detecting atrial fibrillation. It's important to note, however, that the ECG function only works when you have your finger touching the crown and you actually ask the Apple Watch to do an ECG. It can actually prompt you as well. So using the optical sensors on the back of the watch, it uses PPG to detect your heart rate. This is a technology that we've seen in the other Apple Watches and various fitness trackers and other smartwatches. If the Apple Watch detects an irregular heart rate, it will prompt you to perform an ECG. So what exactly is atrial fibrillation? Let's start with heart anatomy. Now we have 2 atria and 2 ventricles in the heart. So this is going to be your right atrium and your right ventricle, and your left atrium and your left ventricle. Individual is facing you, so this is their right and their left. Now what happens is the actual origin of the heartbeat comes from the SA node, the sinoatrial node, and then it travels through the atria, so it causes the atria to contract, and then it converges here in the AV node. So AV, SA. Now this AV node has a brief pause, and then from there the conduction goes down and causes the ventricles to contract. Now in atrial fibrillation, your smaller atria, these 2 upper chambers in the heart, aren't contracting properly. They have this very irregular fibrillation pattern. So if you look at an ECG, a normal ECG has a little P wave, and then you have the ventricles contracting. So this is the P wave, and this represents the 2 atria contracting in a coordinated fashion. What happens in atrial fibrillation is you have these irregular signals, so you don't have a P wave. That is what the Apple Watch ECG is looking for. Now, atrial fibrillation is the most common type of cardiac arrhythmia, but in and of itself, it's not necessarily an emergency. So a lot of patients have self-resolving AFib. This is where they go in and out of atrial fibrillation. We call this paroxysmal atrial fibrillation. And it can be triggered by things like alcohol or other stressors like getting sick. Most people with AFib are usually not symptomatic, or if they do have symptoms, it's something like palpitations. So there are a few instances where AFib can be more dangerous. Number 1, if you have hypotension, which is low blood pressure. In this instance, the rest of your body is not getting well perfused, meaning it's not getting enough oxygenated blood. Similarly, this can happen if your heart is beating too fast. We call this tachycardia. So specifically, atrial fibrillation with a rapid ventricular response, which is RVR, means that your ventricles are also beating quickly. The atria don't have this, efficient, concerted contraction, so the blood is not pumping effectively through your heart, even though your heart is beating very fast. In this instance, you can again get poor perfusion. Now, sustained AFib is also an issue. Sustained AFib is where you have prolonged AFib. This increases the risk of cardiac remodeling, heart failure, things like that. It also increases the risk of stroke. So when the atria aren't contracting properly, when they're fibrillating, you have blood stasis. And that blood stasis, which just means the blood is pooling there, makes it more likely to clot. You now have a thrombus, a clot in your heart. The issue is when that clot gets dislodged and now travels through your ventricle and into your systemic circulation, you now have this embolus that can cause things like a stroke or other thromboembolic events, which are not good. So there is no denying that the Apple Watch is a pretty impressive piece of technology. It's a appealing device. People want to wear it. It's cool. It's very functional. It's sleek. And yet it also has an ECG function. That's pretty cool. But it of course is not perfect. In fact, it has a lot of limitations. So first off, it's only suited for atrial fibrillation. So this is not going to help diagnose a myocardial infarction, a heart attack, or other cardiac issues. This is just for atrial fibrillation. The function of this is much more limited than, say, doing a 12-lead ECG or having blood tests, things like that we would need to diagnose a heart attack. This is also not for people who already have AFib. If you have AFib, you should be seeing your doctor, your cardiologist, regularly. And they're going to have different workups, different treatments that are suited to you. So for example, if they need continuous ECG monitoring, they'll give you a Holter device. That Holter device has electrodes placed on it and you wear it for 24, 48 hours, and it will provide the physician with a continuous ECG. The Apple Watch does not do continuous ECGs. You have to put your finger on the crown, prompt it, 30 seconds, and then you have a little snippet. That snippet is very useful because you can then send it to your doctor, but this does not replace these other medical interventions. Now this is definitely useful and there's a lot of promise here, but on a population level, we're not sure what this is going to do. No test is 100% perfect. A lot of the functionality and the effect of the Apple Watch is going to depend on the ECG's sensitivity and specificity. Now, no test is 100% perfect. And a lot of what I'm going to say here is speculation because we won't really know until Apple enables the ECG function and we see a lot of people using this and have more data points. The concern I have is that patients may put too much emphasis on the data provided by their Apple Watch. So for example, if a patient is symptomatic and they run an ECG on themselves and it says no AFib, they may have a false sense of security. And maybe without the Apple Watch, they would have gotten properly worked up and gotten the treatment that they need. And with the Apple Watch, they're more likely to say, oh, I'm okay. Again, we won't really know until we see the function out in the wild. The second issue is essentially overtreatment, overscreening and overtreatment. A lot of AFib is asymptomatic or you don't necessarily need to work up. But if this is detecting a lot of those instances, there will be a subset. So some of these, some lives are definitely going to be saved by the Apple Watch, without a doubt. There are also a subset of patients that will be receiving a workup and a treatment that is not necessary. Now you have this additional stress because the patient is like, oh my God, what's going on with my heart? They have to go to the hospital, maybe they call 911. Then they get a workup because the doctor is not going to say, oh, this is not a big deal. The doctor is obligated to work it up. So now they're going to be running these tests on you, and maybe you actually end up getting treatment that you don't need. So this is an issue with overscreening and overtreatment that is a known phenomenon in medicine. Now that being said, I have a lot of hope for the Apple Watch and for this new feature because when they have such a large population, so many users using this, they'll have a large pool of data and they can run various algorithms, use AI on it, and figure out how to tweak the algorithm such that you maximize sensitivity, maximize specificity, and minimize the detrimental effects. So it'll absolutely save lives. It's absolutely a huge step in the right direction, but it's not perfect, and there are several limitations that we do need to be aware of. I hope that clarified some of your questions and concerns about the Apple Watch and the new ECG function. If you have any questions or comments, leave them down below, and I'll see you guys in that next one.